Hi guys, my name is Aarohi Maniar and I am back with a new topic from Complete Dentures. So today we are going to discuss about immediate dentures. So what are immediate dentures? Immediate dentures are the immediate replacement of the extracted teeth. So when you give a patient a denture immediately after extraction of his or her teeth, they are known as immediate dentures. So immediate dentures are of two types, conventional and interim. So what is the basic difference between conventional immediate dentures and interim immediate dentures? So in conventional immediate dentures, these are the dentures which can be later used on as a complete denture itself. This denture that we fabricate can be used as a complete denture itself. Whereas in the interim immediate dentures, it is just a denture given for an interim period of a time or a particular period of time for the patient or to the patient until our complete denture is fabricated. So this cannot be used as a complete denture like for the patient to wear it forever. Whereas this can be relined and can be used by the patient later in the life. So we'll just see about how to fabricate the conventional and the interim immediate dentures. So first, looking at the conventional immediate dentures. So here when the patient comes to you, you extract the posterior teeth of the patient. The anterior teeth are still present. You just extract the posterior teeth and you take a alginate impression. After making the alginate impression, you'll make a diagnostic cast. So after the what will have on the cast, there will be ridges in the posterior areas and there will be teeth which would be in stone in the cast in the anterior areas because we haven't extracted the anterior teeth. So anterior teeth will be on our cast which will be in stone. And then you add 2 layers of wax, 2 layers of modeling wax in the anterior teeth or the dentate region to be blocked out. Okay. After blocking out, you make a custom tray. You do the border molding of the posterior part. Okay. After the border molding, you remove the spacer and you take an impression. So these 4 steps like this and this step, these 4 steps are basically the same as that we use in the complete denture. So extraction of the posterior teeth, then we'll take the alginate impression, we make a diagnostic cast. In the posterior part, we fabricate, in the anterior part, we put a modeling wax in the dentate region to have a block out. Then you fabricate a custom tray for the posterior part and in the custom tray, you do border molding, you remove the spacer, you take an impression with an light body elastomeric material and you make a master cast. After making the master cast, we fabricate the occlusal rims in the posterior part because that is where the teeth have been extracted and we have the space there. So in the occlusal rims in the posterior part and in the posterior part where we have the occlusal rims, we do the teeth arrangement. So the posterior trine is done in the patient. Once the patient is comfortable with the posterior occlusion, the posterior aesthetics and everything, you trim the anterior teeth. So these anterior teeth would be in the dental stone because in our cast, we had this anterior teeth in stone itself. So you'll trim the anterior teeth up to the cervical margins, up to the cervical region. So this will be done randomly, it will be done arbitrarily. And then you arrange the artificial teeth in the anterior region. Okay. Till here we had posterior artificial teeth. After trimming on the cast, you arrange the artificial teeth in the anterior region with reference to a posterior occlusion. You do the flasking and dewaxing and you do packing and processing. And after these steps, you get a finished and a polished complete denture. So this is how we fabricate a conventional immediate denture. After we have this unit in our hand, that is our denture, during the time of insertion, so when the patient comes again, in the first appointment when the patient came, you had just extracted the posterior teeth, the anterior teeth was still there. So when the patient comes again next time, you have to extract the anterior teeth because you haven't extracted that in the first appointment. So you extract the anterior teeth and immediately you place your unit, the fabricated denture. Okay, and you ask the patient to wear that whole unit for 24 hours. The patient does not have to remove because you have just extracted the anterior teeth in the second or the third appointment. So when you extract those anterior teeth, you will have sockets, bleeding sockets or open sockets. So in that sockets, you don't want infection to go in, and when you put a denture which is already prefabricated, it will hold the bone, it will hold the whole area and there would be less inflammation. So after wearing it for 24 hours, the patient can remove it. There would be blood clots formed and it would start healing. and during the later period of time, like after 3 months, 6 months, when the ridge is completely healed, you can do the relining. Why do we need to do the relining? Because we are going to use this conventional dentures as our proper complete dentures. And here, for proper complete dentures, we need to have a seal in the denture. But here we got seal from the border molding only in the posterior areas. We have not shown here anywhere that border molding is done in the anterior region also. So for in the relining phase, whatever the resorptive or inflammatory changes has occurred in the ridges will compensate that during the relining, and the same denture can be used as our complete denture. So that is all about our conventional immediate denture. Now moving forward to our interim immediate denture. So as I told you before, interim immediate dentures are the dentures which can be used for an intermediate period of time. These cannot be used as our complete dentures. We have to make a separate complete denture if we want to give it to the patient. So here it is the same scenario. We extract the posterior teeth. The patient will have the anterior teeth in his or her own mouth. So after extracting the posterior teeth, we take an alginate impression. So with this impression, we make two casts. One we will call it as the duplicate cast, and one we will call it as the master cast. So in the duplicate cast, we'll do the processing things, and in the master cast, we'll pour it in the dental stone. So first we take the alginate impression, and before pouring it for the duplicate, making it into a duplicate cast, the impression will be having smooth ridges. The impression will have a ridge area in the posterior region because there are no teeth, and the molds for anterior teeth, because if you take an impression of a dentate region, you'll have a hollow spaces, or you'll have an impression of the teeth in the impression itself. So in that anterior region where there is hollow areas, we'll pour molten wax. We'll put molten wax, and when you pour it in the whole unit into a dental stone, you'll get something like this. So this is the whole dental stone with wherever the impression had teeth in the anterior region, they will come into wax. So this is the unit that we will get in the duplicate cast. Moving on to the master cast. So in the master cast, we pour it into the dental stone, and here we saw about what to do with the anterior region. Here we'll see about what to do with the posterior region. So after making it a master cast, we'll make the base plates, we'll fabricate the occlusal rims, we'll record the JR, and we'll do the teeth arrangement for the posterior region. Okay. So in the master cast, we do everything for the posterior area. Base plate, then making of the base plate, then occlusal rims, recording JR, and teeth arrangement. After that, we'll call the patient and we'll do the trying. The same thing that we did here. We make the patient try our posterior teeth arrangement. If the patient is comfortable, then we shift this posterior thing. The thing I've drawn in the diagram with the red ink is what we do in the master cast. We have a base plate, we do the teeth arrangement, and after the trying is done, we shift this much region or this much unit to our duplicate cast. So after the trying is done, the trial denture is shifted to the duplicate cast. So what will be our final unit? So what our final unit would look like? We'll have a cast in dental stone. Okay. These teeth which we had already poured in wax, we'll have those teeth in wax, and here we'll have a unit which will have a base plate and our prosthetic or artificial teeth. So when this unit is ready with us, we'll do flasking and dewaxing. So what will happen when we do dewaxing? Whenever you dewax, all the wax will melt. So this unit, this anterior teeth region will melt because they were poured in wax. So here we'll have some hollow space. Okay. And after opening that dewaxed flask, we'll also remove this prosthetic teeth or the artificial teeth. So when you have this molten thing, this is a hollow space. So the teeth that is to be extracted, or the teeth in the anterior region that were poured in wax, will get a hollow space after dewaxing step. And this prosthetic teeth that we arranged in the patient for our reference will remove those things. So when we remove this teeth and this will already become hollow, what will we get? We'll just get the impression in the stone. What we'll get during deflasking? We'll get impression of these, and this, so as such it was molten away, it was melted. So we'll just have the impression of that. So when you have that impression, you have to pour self-cure resin uniformly in all the hollow region, so that all the teeth that we want in our interim denture will be of self-cure resin. It will be uniformly placed. Okay, so you use a self-cure resin in all the teeth molds, and you can do it with a sprinkle on method. It is much easier that way. And after that, after having this teeth in self-cure resin, we continue with our natural complete denture steps, that is heat cure resin is to be packed and flasked. So this is all about the interim and the conventional dentures. That's all for today. I hope you understood this topic, and if you like this video, you can hit the like button and subscribe to my channel for my upcoming videos. Also, please suggest the new topics in the comment section below. Thanks for watching.